Hey there, everybody. Just wanted to do this. It seems like most people should know how to do this, but just to give a couple little points and tips when we're doing this. So we're going to do this one for patient preparation. So typically if we're just doing a AFAST scan, we do not typically need to clip the abdomen, but to kind of get some better images, I am going to clip today and kind of give you some landmarks of how I like to clip. I like to do all of my ultrasounds. When I'm doing a full diagnostic one, I actually do them in lateral over incumbency. When we do an AFAST scan, I typically have them in right lateral over incumbency for that one too. So I'll show you what I do when I'm doing it. First thing I want to do is kind of get a landmark for the xiphoid. So feel up in the abdomen, kind of feel the first area of ribs right there. I'm going to need at least to the level of the xiphoid. Depending on the dog though, sometimes you actually need to go a little bit higher than the xiphoid if they're really barrel chested or something too. So I'm going to start right here at the xiphoid. Right on, buddy. Owners, the only thing owners ever see is the actual clip job. So try to make your lines nice and straight so owners think you know what you're doing. If you're doing it just diagnostic ultrasound, you have them in dorsal recumbency instead of lateral. Sometimes you can get away with not clipping as far up or along midline. But if you are doing in lateral recumbency, to really get a good image of the kidneys, you do need to kind of clip a little bit higher than you would expect. Right, so I'm trying to make my lines look nice and pretty. All right, I'm going to go a little bit higher. He's my own dog, so there's no owners to complain about me clipping too much here. This will just allow us to see a little bit better when we're looking at things in a minute. All right, get all your fur. So patient prep is going to actually have some gabapentin on board for him right now too. So when we start looking at him, we need to start thinking about what areas are we going to be looking at for that AFAST scan. When we're looking at an AFAST scan, FAST is just the focused assessment with sonography for trauma, triage, or tracking. You can kind of use any one of those T's I've seen used on different places. So if we want to start thinking about it, we're going to have 4 locations to our abdominal FAST scan. We're going to have one kind of right here. We're going to have another one right about here. We're going to have another one kind of right along midline here. And then the other one is going to be underneath him for our number 4. If you think about this, I kind of think about it like in a clockwise fashion for our 4 different views that we're going to be looking at. We got a 12 o'clock, we got a 3 o'clock, we got a 6 o'clock, and we got a 9 o'clock view. What this is really doing is just giving us a global view of the entire abdomen. When you think about our AFAST scan, we're really looking to see, is there fluid or is there not fluid? So if there's, we got abdominal fluid scoring system too, an AFS. So if there's fluid in somewhere, you'll see some places talk about giving a half a point or a full point. That just goes by if you see like a 1 centimeter pocket of fluid, then I give it a full point. If it's less than a centimeter, then I give it a half a point. And when I do, I see, is there any fluid in spot 1? Is there any fluid in spot 2? Spot 3 and pot 4. If there's spots fluid in all 4 locations, then we got a 4 out of 4 abdominal fluid score. If we have just in 1 location, it would be a 1 out of 4 is what we're looking at there. So if we're looking at these, you kind of think of 1 to 2, if that's your total abdominal fluid score, would be consistent with a small volume bleeder. A 3 or a 4 would be more like a large volume bleeder. So that's what we're looking at here. So on our 4 sites, I just enabled a 1, 2, 3, 4. Number 1 is going to be our DH view, or our diaphragmatic hepatic view. When we look at that one, and we'll go view by view with the ultrasound machine to kind of show these, but I just want to introduce our 4 different views. So we got our DH view, so kind of down here, we got a DH. So diaphragm, and we'll show you what that's going to look like, and your hepatic view. This one's going to be a subxiphoid, so kind of find that xiphoid, go up underneath the rib cage, and point cranially, and that'll get a nice image up there. What we're looking for that area, see if there's any fluid between the liver and the diaphragm. We can see fluid between the lobes of the liver. We can also sometimes see pericardial or pleural effusion, because if we see the other side of the diaphragm, we've got the thoracic cavity too. So we actually see a whole lot in that view, which is nice. Then what I wind up doing is I'll get a couple sprays of alcohol on each spot. I kind of follow this rib margins down here. So I'll follow the rib margins until I kind of right to the caudal aspect of those ribs is going to be my second view, or right about my 3 o'clock view. And that's going to be the splenorenal. He's in right lateral recumbency. We know the spleen is on the left side of the abdomen. So I'm going to see spleen, and just cranial to that would be the kidney. So I'm going to find that location, see if there's fluid or not. Keep coming around my clock to my number 3. This is going to be my systocolic, so our urinary bladder and the colon. So kind of right along midline at that 6 o'clock view is what we're seeing here. Systocolic, very sensitive area. A lot of times, even there's small amounts of fluid, you'll see a little bit right on that cranial aspect of the bladder. So that's a great thing to do. And then also just checking to see if there actually is a bladder. So if this was a trauma case and you're worried about a bladder rupture, I want to see, does he actually have a bladder? And if he does, is there any fluid adjacent to it? Our fourth one is going to be our HR view. HR view is kind of just going to be the other flank, or the opposite of this number 2, just down on that right dependent side. So I normally just lift their chest up a little bit, get another couple squirts of alcohol, and right along that border of the ribs, kind of sticking my probe in there and see if I'm seeing any fluid. It's called HR because it's the hepatorenal view. Hepato for the liver. Renal is going to be our right kidney now. If you remember your anatomy, the right side of the liver has the renal fossa. So in dogs especially, that kidney is going to be kind of sucked right into that renal fossa, or laying within that little pocket on the right liver. So you kind of see them continuous with one another. Cats, we don't have it kind of up in that renal fossa as much, and their kidneys are going to be a little further caudal down. So that's going to be our fourth view. So again, we just take all those 4 views, add up their fluid scoring system, and see what we've got. The other thing I see people do is they learn these different views. And let's say this is my ultrasound probe. Like, yes, I found the spleen and the kidney up here. And they just look and have the probe, and they never move the probe. Well, that's not really going to get a good view of this whole abdomen. What we're really trying to do is kind of image the whole belly, but doing it really fast. So if I find the spleen and the kidney in my one little view on my ultrasound, we call it fanning the ultrasound probe, or fanning the tail of the probe. So if this is the tail, this is the head of the transducer, or the footprint touching the patient, I'm going to kind of fan it this way, fan it dorsally, ventrally, caudally, cranially. So kind of looking in a big circle around here. What I'm doing is really checking for fluid in this whole region. I'll do it the same thing up here. So if I come out here, cranial, caudally, ventrally, dorsally, now I'm getting this big circle to look for fluid. Same thing down here, I'm looking at this big circle for fluid, and the same thing underneath. What I've really done is found 4 locations at 12 o'clock, 3 o'clock, 6 o'clock, and 9 o'clock, and do a global view in each one of those and seeing if there's fluid present. So I can do this to see if anything's bleeding. I can do this for tracking. If you come in and the patient maybe had a fluid score of a 1, and maybe I wanted to check them again in 4 hours, I can see, okay, did this go to a 2 or a 3? Or maybe you had you're worried about your spay from earlier in the day, and looks a little more pale, and you're worried about him still bleeding. And I check the belly and it's a 1, and I'm like, ooh, there's fluid in there, but is it bad? Well, let's check again in a little while. That'll be our tracking part of the fast. So I can track and see if this is developing more, or is it staying the same, and that'll give me an idea of what I need to do for my patient. All right, so that's our patient prep. Next, we'll kind of look through each view with the ultrasound machine and kind of give you some tips on how to find each view as easily as possible.